I'm Carolina from Making Life, and today I'm here to interview Mr. Thomas Fricke, EMA Pharma Commercial Director and EMA Safe Pharma and Cosmetics Sales and Marketing Director.
Thanks, and good day to all of you, first of all. Thanks.
We are here to talk about sustainability. So, the requirements of the pharmaceutical industry are constantly changing. Customers are now looking for more sustainable and automatic solutions in the pharma sector. In this scenario, what are the opportunities for pharma solution suppliers like you?
Right now, it's a kind of pioneer time where when you are investing, you can be in a real good position to support your customers and to bring, let's say, new solutions to their new requests. And luckily for us, the combination of sustainability and digitalization or automated solutions is really working together. We have seen so many examples where a machine which is much more automated and much more controlled, with much more KI or artificial intelligence inside, can save water, for example, in the washing process, can save energy in the production process. So these two scenarios are going one to each other, and our customers are asking exactly for this. Asking maybe is not enough, they are demanding it. And this is honestly what I was hoping for and what I was waiting for, that these nice questions were becoming solid demands, because we would like to do something as IMA, and it's better when there is also pressure on the customer side coming towards us, because it will be then, let's say, valid for all our competitors also. So it's not only us investing this, because it's really an investment here.
How would you explain the all-in-one pharma strategy?
I think this is the big advantage of EMA as a group of around about 7,000 people, 2 billion euro of turnover. With such a group, you have plenty of tools to work as a supplier which can provide a complete solution. So your problem is not you want to pack a blister or you want to put liquid into a bottle. You want to develop the product, and then when you have developed it, you want to mix it, you want to fill it, you want to label it, and you want to bring it to the pallet. So in this process, a fully controlled process, by the way, it's quite a hard work for the continuous decreasing technical departments of our customers to synchronize all the machines. Besides the fact that they have to put a lot of engineering power inside, they have to do also a lot of logistic work inside. Just to give you one pragmatic example of today's life, to provide the testing material for new technologies or for new production or packaging lines is a challenge for our customers. They are not capable from their suppliers to provide the new materials, the new packaging, testing materials. So it's really a challenge, and we try to help them to reduce also this necessary material for the tests. And in the all-in-one strategy, we are giving from the washing until the pallet all the solutions out of one hand. So a customer could buy with one contract from one supplier. We have just in the recent 2-3 months, we had projects with very high values, where we have done also together with the customer the engineering and the rendering. Means to see also how in a virtual reality the new facility will look like, and this is possible with all the machines coming out of the EMA portfolio. Pretty sure that there are still some gaps in our portfolio, like the water treatment, like some blow and fill machines for sterile products, but in general we should have nearly everything, and this is a risk reduction on the customer side, and this is why we see that we are successful. The point was internally, because it looks easy when you say you are one family and you just have to decide you want to do an all-in-one strategy. But I think, as an example, try to make a birthday party and try to organize for the date and for the location with 5 brothers, and the wives together with them. It's a nightmare to coordinate this at the beginning, but when it comes to the event itself, to the line itself, the result is fantastic.
What are the latest trends in the pharma packaging industry?
That's quite difficult to say, because I think pharma industry was always trying to help people, and this excludes automatically to bring bad things like bad packaging material, a lot of waste to their customers, to their patients. So they were one of the first, in my opinion, thinking about it, to do something better than the standard which was existing. So now on all the different levels of production, they are trying to have new packaging materials, sustainable materials in the primary packaging, but also in the blister world, in the world of plastic bottles, in the world of recyclable labels. You know, the case packers were always quite sustainable because they always have used recycled material, but now also they are coming towards more sustainable gluing systems. So don't use a cardboard case together with a plastic closing tape. That doesn't make sense. So now there are also paper solutions and something like this on the way. But the trends in this packaging industry is one is the sustainability, and the other one is strangely, one is high speed and the other one is very low speed. High speed for the products which are having a very low margin. You talk about aspirin and other OTC drugs.
Okay.
And the other ones are the new oncology products, the personalized medicine, which are costing a fortune, where we have the new robotized solutions. And the use of robotics in this new world in pharma is not anymore like in the past only in the pelletizing area. It starts at the beginning, in the opening and feeding of products, till the handling of bottles in a liquid filler, till the labeling, where you can also work with robotics. You will find them everywhere where a human should not interfere. Because if you are working oncology products or other products which are dangerous, hazardous for the operators, then a robotic is very much appreciated from everyone around the world. Many people have problems with robots, but nobody is angry about a robot which is doing his work. When we talk about Frankfurt Airport and taking a bag which could includes a bomb. So this should a robot do, and in our lines a robot is working with very dangerous products also.
Can you please mention any one of your latest technologies for the pharma sector and tell me what are its features and benefits for the sector?
I think nowadays, you know, my heart is beating mostly for packaging. So the Triton, our robotic cell for packaging of vials, syringes and so on, is state of the art. So a changeover in less than 10 minutes is nowhere possible when you go from product A to product B on a line, means including line clearance. So this system, I would say, our packaging island is self-adjusting. So nowadays in the EMA portfolio, most of the cartons can have self-adjusting features. This one is completely full of self-adjusting features, so nobody has to do anything there. But let's say if this is the normal league, the Champions League is the injector, or above that, in my opinion, the new cell and gene therapy machines, because the cell and gene is a request for a batch size of 1,000 to 3,000 products. And it means you have to work them very fast. They are so much temperature sensitive that the speed and the variety of time where the product is remaining into a higher temperature, because we cannot work under conditions of minus 80 degrees or minus 120, but for a short time we need to fill liquids into vials or whatever container syringes, and during this time when we fill it, it has to be around about 20 degrees, but it has to be as short as possible. And with our new planar system, where we move, let's say, it looks really magical, the vials from the filling station to the capping, to the all the quality controls which you might have and which might differ from the request from the past. This is what we have there, and I think you will see something more about this during ACHEMA next year. So this is just something up front for you.
When it comes to environment, sustainable packaging is today's buzzword. How does it impact the pharma packaging industry?
It impacts a lot. Let's say there is no week where we are not talking about this with one of our big pharmaceutical companies. We have invested in 4 physical existing laboratories where scientists are working together with technology experts and material experts in our labs, and whenever it comes to the point that we have to run a new material on an existing line, we take our engineering experts from this line together with these scientists and pharma technology experts into this open lab, and we are trying to find solutions for the new materials. So all the new sustainable materials have to be tested, registered before they are coming to the market. And this is where we help people, not only in the pharmaceutical field, and this is again EMA's strength. We are doing the same for the food industry, which in some areas they're a little bit advanced when the new material is cheaper than the older one, which in some cases is even the case. So there are a lot of reasons to become more sustainable. In the pharma industry, it's more a pain because the registration process takes really very long in order to make new materials. So we are now, since a few years, registering new materials, and always with the same strategy or philosophy from the beginning till the end. So we start at the beginning of the process, and then with blisters, plastic tubes, overwrapping material, the case packers and so on. We are trying to make for the complete supply chain. We are trying to provide sustainable solutions, even for tube fillers with new laminate tubes, recycled materials.
Can you give us more information about what sustainable packaging for EMA is?
Yes, since I started in EMA in 1992, and I understood quite early that my, at that time, boss, Alberto Vacchi, the CEO of EMA, was very environmental orientated from the beginning. He was, for me, always the green guy who focused on, we should develop something here. Thomas, why do you think we still have to have this PVC blister? Don't you think there is chance for a new material? I was, honestly speaking, I have studied plastic engineering, process technology, and I have worked on recycling, but I never thought that this conservative industry will try to move that fast. With the push from Alberto Vacchi, and let's say the investments, the budgets we were getting in order to develop something new was really extremely good. So we started very early with this field, and we were the first to supply the polypropylene monoblister in Germany. So let's say in the mouth of the wolf of all these German suppliers, EMA, Italian suppliers were providing solutions for polyprop monoblister, and that's already 25 years ago. Like 20 to 15 years ago, we were the first to supply to China fully cardboard packed syringe packaging, so pre-filled syringes in cardboard packaging, where everybody else was still talking about PVC film. So in my opinion, we were very early. We got the budgets from our boss, and now everything needs to be sustainable. Whenever we have a meeting with the CEO, that comes on the topic. We have hired a new sustainable officer in EMA, so there is even now a complete new department created for following this topic.
EMA's vocation in the pursuit of innovation reflects the importance of research and development. Can you tell us about the group's commitment in innovation?
Let's say, I think at the beginning of the interview, you have told the people about my role in EMA. Yes. So I'm the commercial director of Pharma, but nevertheless, I'm proud that Pharma is only 52%, 50% of the EMA's turnover, so it's 1 billion, and the other billion are within our CEO's interest, also with the focus on innovation and research. So just touching shortly the topics, our automation group is supplying e-motor solutions, so e-mobility solutions, including battery solutions for new electronic cars. The other department is developing new packaging machines, which are suitable for the internet dealers. Let's say you want to order something via the internet, you know that usually you will receive at home a package which is at least double the size of what you have purchased, and so inside there is a lot of air. Transporting air means not being environmental friendly. It's too much material, it's cost too much volumes. EMA has developed here also a new solution, a new machine group for the e-commerce, adapting the packaging to the size. In my pharma area, research and development was always something where one thing was we were following the new regulations. The other thing was also that in pharma the cost pressure was coming up. So the cost pressure was leading at least to these buzzword of continuous production. Continuous means I don't have to work in batches, I don't have to clean containers only because this is the maximum size I can handle. I can have a continuous process which is reducing the waste of material, the waste of good APIs, and it's improving the output of a machine. So in both areas, solids for the continuous manufacturing and continuous coating, and in the liquids for the continuous freeze drying, we have nowadays continuous solutions. And I think this is an ongoing process. Problem is with such a process is really demanding a lot of budget, because it takes a lot of time to also to change the mentality from the thinking of batches, means the multiplication of a container. So you have a container which has 1,000 liter or 10,000 liter, and then your batch is 4 times this or 2 times this. In continuous world, that's not the case. It's about hours, how long you run the process, and this is giving you some extras in terms of cost reduction. This is the one thing. The other innovation are the new technologies, as we mentioned before, talking about cell and gene therapy, talking about the new robotics, and all of that in combination with the sustainability approach. So we have a centralized R&D group, which was necessary because all of us, we were trying to do the same within our departments to figure out where we can save energy, where we can save washing, detergents, and so on in our processes. So our head of R&D, Dario Orea, was giving the different departments different tasks in order to have one solution for one field and then to duplicate it, which is again showing that we are in a happy position as a big group to have this centralized approach. And then we are working also together with a lot of different NGOs and universities in order to support them, and they support us in finding new and innovative solutions.
EMA for sustainable development. Which are the next steps?
Next steps for sustainability?
Yeah.
This is quite difficult to say. So I think we were one of the first to start in 2017. And if you would have asked me at that time, well, what would be our next steps, I would have been totally wrong. Now I know a little bit more about it because with the talks with our Marie-Charlotte and Danica and Stefano Catardella, our professor which is leading a little bit this department. we are having an idea where we want to go. And you know that right now the goals for the UN Sustainable Development Goals, these SDGs, we have achieved some new targets, but we are setting other new targets. So I think that in everybody's brain or thinking, you talk about STBIs. So STBIs, the science-based SBTIs, sorry, science-based target initiative is always in our mind, and we are trying to set the goals for this in order to be neutral, measured in this direction. It's just within such a group like EMA, and there comes, let's say, the negative part. It's quite difficult to find somebody who is helping us, supporting us for the consultancy of such a requirement. If you're working only in pharma, it's easy to say, okay, these are our targets. But if you work in e-mobility, in food, in cosmetics, and in tobacco, and so on, so there are so many different fields where one, most probably as a consultant, is not enough. So the new steps are creating this new department, which has already started, defining the new reports, because we are constantly providing the sustainability reports since decades, I would say. So we have always been very transparent in this regard. This will continue with the new department. We will do a lot of improvements, and we will also go very pragmatic into this discussion about sustainability. We will go facility by facility with our new sustainability officer to figure out what we can do in the small daily life to improve the situation, not always in the big pictures and the big reports, but in the daily life.
Thank you so much, Thomas, for your time, for sharing your knowledge, and to be here with us today.
Thank you for asking me. It was a pleasure to talk to you.